Hello everyone, my name is Dr. Patricia Koromvokis and I'm a lecturer in Modern Greek Studies program in the Department of Media, Communications, Creative Arts, Language and Literature at Macquarie University. It's a great pleasure and honor to be presenting in the online international conference, The Value of Languages in a Multicultural World, the Multi-Greek language teaching program, which aims to equip non-Greek carers and other professionals of a bilingual aged care facility Sydney with basic oral language skills. The teaching program also provides the necessary cultural awareness to enable effective use of Greek in face-to-face encounters with Greek-speaking residents and their family. The program is a partnership between Macquarie University and a Greek-Australian aged care facility, and it is funded by the Multicultural New South Wales. The aim of this presentation is to showcase an example of good practice which emphasizes community engagement and practical positive outcomes for staff and residents of a bilingual nursing home. Due to the time limit of this presentation, I won't proceed into a great detail on the profile of Australia's older population and that of the care workers in aged care facilities, as I will focus mainly on the language needs of aged care workers and the logic behind the design and the implementation of the teaching program, as well as what the next steps are. Australia, like many other countries, faces the challenge of caring of an aging population. This challenge is compounded by the fact that Australia is a vibrant, multicultural society with a diverse range of service needs influenced by a range of factors. Older people make up a considerable proportion of Australia's population. In 2017, over 1 in 7 people were aged 65 and over. The majority of these were born in non-English speaking countries. According to the National Aging and Aged Care Strategy for CALD people, by the end of 2021, more than 30% of Australia's older population will have been born outside Australia. In 2011, there were a total of 178,340 care workers in Australia, up from 131,283 in 2006, representing a 36% increase in 5 years. While the number of carers from all regions has grown, the increase from 2006 to 2011 has been the highest for carers from South Asia and Sub-Saharan Africa, with relatively modest increases in carers from the UK and Europe. According to the National Aging Research Institute, some of the major challenges in aged care sector are cultural differences and language barriers. More specifically, it is stated that many CALD people are reluctant for themselves and their relatives to utilize aged care in Australia, either home care or residential services, because they fear that facilities or services are not culturally safe, as providers and their staff will not cater to their cultural needs, or that they may face racism and discrimination. A workforce which has mandatory specialized training in communication for aged care would go some way in addressing these fears. Adding to this language and cultural gap, in Australia, the residents and staff in aged care facilities compose a major proportion of the positive COVID cases and about 1/3 of all deaths from COVID-19, probably due to the communication gap. Taking into consideration the aforementioned data and the fact that everyday communication and its associated cultural connotations for residents of aged care facilities whose first language is not English often affect the quality of the care they receive and the general well-being, and that this has been even more pronounced during the COVID-19 pandemic, the need to overcome the communication gap between staff and residents in multilingual nursing homes in Australia has become more important and more urgent than ever. Aged care facilities should respond to this situation in order to improve and sustain quality in their nursing homes through the up-to-date professional training and skills development of their staff. Over recent years, as the Australian aged care sector has evolved, the specific care needs of individuals have become an increasing focus of policy development and service provision. Thus, Learn Greek for Better Communication in Aged Care Sector during COVID-19 pandemic is a 5-week teaching program in partnership with a Greek aged care facility, and it is funded by the Multicultural New South Wales. The intense teaching program includes 5 2-hour face-to-face weekly modern Greek language lessons. 10 carers participated. The lessons started earlier this year and paused during the lockdown and have been successfully completed 2 weeks ago. So this project is about teaching language for specific purposes in a non-traditional language learning environment, and it has 3-fold benefits. First of all, the foreign staff of the aged care facility will build in-demand career skills. Consequently, the aged care facility will improve and sustain quality by closing the communication gap between the non-Greek staff and the Greek-speaking elderly residents. And the university will collaborate with aged care sector stakeholders by designing and implementing short teaching courses targeting the development of professional skills in workforce challenges. Teaching language for specific care purposes has to focus on the language needs of the carers. So the question was, which are the language needs? Or in other words, which language skills should the foreign carers of the nursing home develop through this language teaching program? Previous related research, like LIA's qualitative study, which examined the Spanish linguistic needs of working healthcare professionals, has shown that the specific linguistic needs have been divided into 4 categories, beginning with the easily identified productive needs and moving toward the more challenging receptive needs. The carers need more input and more strategies for dealing with input, as well as a move towards understanding the second language system. For these participants, the development of linguistic competence was contingent upon both receiving input in a comprehensible form and producing comprehensible output. LIA study participants first identify easily rectified linguistic challenges such as lexical gaps, pronunciation problems, and a need for written resources in appropriate forms. Once those needs were addressed, participants moved on to a more problematic need, which they articulated as a sense of how the language works. This desire to be able to create with the language instead of using fixed scripts that they only understood at the semantic level meant that the carers were starting to move beyond the semantic gaps and address more specific syntactic and grammatical gaps. Thus, the language course for specific purposes concentrate on oral communication issues through the use of a process-oriented approach in which learning how to learn is as important as learning how to produce specific linguistic forms. The course is designed to help working professionals to develop communicative competence, including a focus on strategy instruction for lifelong learning, intensive weekly practice with listening and listening strategies, and an approach to oral production in the classroom that focuses on spontaneous conversation for informational cognitive purposes. Apart from the specific linguistic needs for the development of the teaching material, we took into consideration two factors. First of all, the fact that the aged care staff in this study do not have time or the appropriate resources to study a language for the sake of studying language. And secondly, the fact that Greek is a morphologically challenging language for speakers of other languages. Thus, a specially designed textbook was created and used where participants were exposed to basic Greek grammatical rules, for example, verb conjugations and noun declensions, which should help them to use the language in a variety of everyday situations. Vocabulary is being taught based on a practice-relevant content that is necessary for dealing with situations or Greek language needs arising in daily care. Pronunciation exercises are important for ensuring better oral communication between nurses, residents, and other team members. Apart from grammar and vocabulary, a class includes audio, video of native speakers role-playing patients. Students engage in a work-related dialogues, beginning with skeletal small dialogues and working towards more spontaneous dialogues. Students learn specific linguistic content based on their needs. For example, in a class, students might make two lists. The first list is the list of triumphs, which are words or expressions that they understood since the last lesson, and a list of challenges, Greek words or expressions that they heard, but they were unable to understand. As a follow-up to the challenges, the teacher could helps the students develop an understanding of the linguistic system by explicitly addressing the grammar behind the things that they repeatedly say or hear in the workplace. In other words, students would try to discover what they don't know. This is a table of contents of the textbook. The first two lessons focus on pronunciation and excuse me, and Greek greetings and sayings. Then we move on with verbs and nouns, which are closely related to the everyday activities that the carers with the elderly residents perform, and the most frequently objects that they use in the aged care facility. Lessons 5, 6, 7, and 8 focus on family, body parts, well-being, food, days, months, and weather. The second last lesson is on communicating with seniors during pandemic, and we conclude with the traditional Greek greetings and wishes for the most significant cultural, national, but also personal celebrations. Just to give you a glimpse of the textbook, in lesson 2, carers are introduced to the concept of verb conjugations in Greek language, and in lesson 3, they apply this knowledge to verbs that are related to activities that they do at the aged care facility with the residents. For example, we first do the 6 endings of verbs type A, and then the students apply the endings of these verbs in verbs like fitevo, which means to plant, as gardening is one of the most stimulating physical activities that the elderly enjoy in the aged care facility. In lesson 4, the students are introduced to the Greek noun declension system. The vocabulary of the lesson is developed accordingly to the objects that they use in the nursing home. Then they use the nouns into full sentences. For example, one of the nouns that they are taught, in one of the neuter Greek nouns that they are taught, is the word to akustiko, which means the hearing aid. Then the students use the word in role-play speaking activities, such as Τι θέλεις, what do you want? Θέλω το ακουστικό μου, I want the hearing aid. In lesson 9, students are taught the nouns of essential objects during pandemic and how to communicate effectively in Greek with the elderly residents and how to advise them in Greek in order to practice good hygiene, including washing their hands, keeping distance, or even covering their mouth when they cough. The last lesson briefly presents in English the cultural meaning of Greek national, cultural, and personal celebrations, again accordingly to what is celebrated in the aged care facility all through the year. The carers practice saying traditional Greek greetings for every occasion. For example, we speak about the importance of the commencement of the 40 days of Lent before the Greek Orthodox Easter, which we call in Greek Sarakosti. Then the carers, students, practice the Greek special wish, which we say in Greece, which is Kali Sarakosti. Also, they practice singing the Greek birthday song and how to wish happy birthday and happy name day in Greek, as name days are very special and very important in Greek culture. As I mentioned before, the lesson started earlier this year, paused during the lockdown, and had been successfully completed 2 weeks ago. On the last lesson, the carers were asked to participate in an anonymous voluntary survey on the effectiveness of the Modern Greek Language Culture teaching program, providing feedback on the course teaching material, the in-class speaking and listening activities, and the usefulness of the course in the communication between carers and Greek elderly residents. A very preliminary analysis shows that even though the intense Greek language teaching course was useful in the discussions with a resident or even a client or a visitor in the aged care facility, or it was helpful in understanding residents' Greek phrases and then reply to them in simple Greek, or understand the most important points from a basic dialogue in Greek, the majority of the participants, of the carers, wrote that maybe some more extra lessons would have been very useful. You could scan this QR code so as to watch the promotional video of this teaching program. Thank you very much.